Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. CHA2DS2 VASC scoring for risk of stroke and the oral anticoagulation need in case of the AF. So first let's look at the components. The components is as the name suggests, so C for the congestive heart failure. And then first let's look at the components and then we'll discuss the scoring. Then H for the hypertension, A for the age that is greater than that of 75 years. Then D for the diabetes mellitus. Next comes S, which includes the stroke or TIA or the TE. To watch the full video, please click on the link below and it will redirect you to the main video.